Hello there, and welcome to Yodo. This is the third and final segment in a series on Sentinel Events. Sentinel Events are a patient safety incident or close call. They can cause serious or permanent harm or result in the death of a patient. This topic was introduced a few segments ago, and if you missed that beginning one, you might want to go back to listen to the information because it does discuss some of the basics about Sentinel Events and the reporting that's involved in these. Today we're going to review two more Sentinel events in a little bit of detail. I have spared you this time from some of the detailed statistics that I gave with falls. Today we're going to learn about medication safety and elopement. Medications are a very important part of healthcare, and we want to confirm the right patient receives the right medication at the right dose and the right time. A few other essential components to medication safety include the right reason for the medication, the right route of administration, and the right documentation. And that's why this often is called the 7 R's of medication administration, or the 7 rights. Each of these steps has detailed components. Medications are one of the many areas where safety is a high priority. This domain is not limited to pills, injected medications, but also includes IV administered substances and administration of blood and blood products. Proper administration of medications without error is a key component of patient safety. In facilities and hospitals, there are a variety of checks and balances across many disciplines. Certainly nursing staff, pharmacists, nurse practitioners, and physicians, but it also involves many other disciplines. It involves policies for exactness of those 7 R's. Other staff that directly support this process include several other disciplines, including software engineers, as well as the people who program the little machines called Apixis that many facilities have, sort of like a tiny pharmacy on each unit of a hospital or in a nursing home. There is ongoing teaching of staff, review of medications for formulary, watching medication outdates, following the literature for alerts, checking for manufacturing recalls, observing new medications that bring about advancement. Nursing and pharmacy, as well as clinicians, are always reviewing medications, and there's ongoing monitoring and cross-referencing for allergies of patients. Software programs are updated and run cross-checks of medications to alert providers of drug interaction risks. For medications at home being cared for by a home health nurse, they can actually help the patient quite a bit. They can provide education to the patient and those that help them with their medications. These are reviewed often with confirmation that ensures understanding. Medication lists are matched with the meds that the patient has in their home. Patients that have help from a visiting nurse, this staff member will perform many tasks. They assist and review to ensure that the medications are being taken appropriately, and while they also will monitor for the effects that these medications are having. They're going to watch for side effects or findings that reflect the patient is not tolerating the medication. For patients with a hospice vendor, they not only will have advantage of the visiting nurse, but they are also going to have multiple other disciplines that will visit the patient in their home to assist and ensure that the medications are accurate, in adequate supply, appropriate monitoring is being completed, and symptoms are being managed. One of the greatest benefits to the hospice group of patients is that these patients have the ability to call the hospice agency anytime, night or day, to ask a question or request the nurse to come to their home and evaluate the patient and perform an assessment. And that's 24 hours a day. The nurse will then contact the physician to relay the findings of that evaluation while the nurse is still in the home. The hospice nurse practitioner and physician may also make home visits for the patients that have accepted hospice care. As an example, to provide adequate pain and symptom management for palliative and hospice patients, the opioid class of medication is typically used. The group of medical specialists that provide this level of care are highly trained in the safe use and monitoring across the spectrum of medications that are used to manage pain. There are a few videos on the channel that cover pain medications and why we choose the ones we do and when we choose them. One of the side effects that we monitor for very closely is constipation. This is a common side effect, and therefore a patient's bowel movements are tracked closely. When a patient on opioids becomes constipated, that is not necessarily a sentinel event, but if the constipation is so severe that hospital admission is needed to manage it, or a bad outcome occurs, then it could be a sentinel event. I hope you can see how that distinction makes sense. It is the responsibility of everyone that helps the patient to ensure that all side effects are monitored for and treated quickly and appropriately. Cognitively impaired patients need monitoring done even more closely. To help with monitoring bowel movements, I encourage patients and their loved ones to place a calendar with a pin in the bathroom so that these can be tracked more accurately and easily. Side effects must be monitored for because they can have serious repercussions far beyond what is commonly associated with constipation. If a patient gets constipated and is admitted to the hospital, then any one of those things in the video about a hospital not being as safe as you might think might come to fruition. Check out that video if you haven't seen it. Patients with the assistance of home health or hospice staff visiting them and following the effects and side effects closely have fewer medication incidents that place patients at risk. I've had so many patients and their spouses that want to manage their own medications, and that truly is wonderful. Knowing the name, purpose, dose, and frequency of a medication is so very important. However, working with a nurse when that pill planner is being set up and relinquishing a little bit of control can reduce the burden for the patient as well as their family. I truly appreciate when a medication list is being kept up to date by the patient and that they keep a health journal as well. Patients that receive blood may not realize all the safety measures that are in place to ensure that a correct match is being made to provide the correct products to them. Patients that have received numerous transfusions or multiple platelet packs can experience an increasing rate of side effects. They require close monitoring and may need blood that meets specific criteria. Allergic reaction risk is not often even considered by many patients, but that risk is real. These reactions can be immediate or delayed. Reactions might be as simple as hives, itching, or fever, but it could be something more serious and a very serious complication that can occur as death. The most common cause of a transfusion-related death is a reaction that can occur when a patient's own antibodies in their own plasma attacks and destroys the donor cells that they've been given. Other risks include, but are not limited to, fluid overload, syncope, altered blood pressure, and hematoma. The risk of transfusion-transmitted infection has fallen very low in the United States in the prior years as donor screening is stringent and the serologic and nucleic acid tests performed on the blood are extensive. Other and more rare risks are present, and they might include a transfusion-related acute lung injury, and this is a reaction when the donor plasma contains antibodies that damage the patient's own lung immune system and cells that can lead to fluid buildup in the lungs, preventing the patient from receiving oxygen. Another rare but frightening outcome is a graft versus host disease process when the donor cells will attack the patient's own cells. Although these risks are real, many can be minimized. A reaction of some kind typically does occur, though, in 1 of every 100 transfusions. Blood transfusions are life-saving procedures and can improve patient outcomes, yet the need for ongoing blood administration can expose some patients to unacceptable risks. Precaution is taken at every step of a transfusion process for each and every patient. Every time a blood product is ordered for them. The products must be administered under strict guidelines and in a time-sensitive manner with ongoing close monitoring of the patient. I want to stress that receiving blood is not a simple or mundane process. What goes on behind the scene of a transfusion can be mind-boggling once you learn how much actually has to take place for a person to be safely given blood. Lastly, I will briefly touch on another sentinel event, elopement. Patients with cognitive impairment are a special population. When dementia is advanced, they become unable to assess risks and likely are not able to accurately judge their own ability to remain safe. Some are still able to ambulate, however, their safe ambulation skills may have become impaired. Balance might be askew. As the disease progresses unavoidably, the patient becomes unable to accurately and consistently interpret environmental risks, and they can expose themselves to harm. When a patient has unauthorized exit from any facility that is staffed 24 hours a day, be it a hospital, emergency department, memory care unit, or assisted living facility, that is an elopement and it's a Sentinel event. Patients with dementia have been known to walk out of a facility. An emergency department poses a particular risk as often these are not locked environments. But locked facilities can also have an elopement. Residents from a memory care unit may follow a non-employee, a vendor, or someone visiting a different person from that locked facility environment. This safety event is also reported to the Joint Commission, and a similar scrutinization of the information of the elopement is initiated. The unauthorized exit by a patient with cognitive impairment is a serious patient safety occurrence because of the consequences for risk of injury and death. Patients may not be able to judge speeds of cars, they may not be able to ambulate safely away from the building, may not be able to get back to the building, they may not be able to judge temperatures, and may not be able to judge when they're tired. Facilities that provide care to this population are vigilant to ensure that elopement does not occur. Hospital elopement was less than 2% in 2023, and most of these were from emergency departments. The numbers from nursing homes across the United States remain approximately 1 per day for the last several years. Each facility has a standard operating procedure regarding the routine monitoring of patients for safety and their location. There are also policies for initiation of a search for and reporting of a missing patient. This segment completes the series on Sentinel Events, serious patient safety incidents that occur in a hospital or care setting when staff is present 24 hours. Considerable effort, time, and resources are put into the prevention of Sentinel events. They are harmful to the patient and the healthcare system. Efforts involve measures beyond the local level. Most organizations will pay for Joint Commission surveys in hopes for accreditation. Evaluation by JCAHO is sought by the majority of healthcare organizations for reasons of ensuring patient safety as well as qualification for billing and payer source eligibility. Standard operating procedures that establish safe processes are reviewed in an ongoing manner, and when an event occurs, a special team launches a targeted, in-depth analysis of all activity that surrounded the event and may have played a role. Sentinel events exclude specifically disease progression-related events that are a part of that disease process. We specifically reviewed falls, medication errors, and elopement in a bit of detail. We did not cover the many other risks under this umbrella: development of wounds, diagnostic delay or error, surgical-related issues. Fall safety, being a priority for institutions that care for individuals with cognitive impairment, present a particular challenge as we want to protect those individuals as well as respect their rights and freedom to remain as independent as possible. Medication safety is ensuring that the 7 R's of correct medication are all present. It also ensures that side effects are being monitored for and managed appropriately. This has just been the tip of a dangerous and expensive iceberg that we've covered. Every health provider, hospital, and ambulatory facility has a patient safety team. When a Sentinel event occurs, immediate response begins and the complex process of evaluating how this occurred. This event triggers an in-depth scrutinization of the processes surrounding the event to uncover needed changes to drive further incidents of this nature to zero. We do not want to put a price on safety, but the measures that are put in place must be done in a fiscally responsible way that's reasonable to respect the patient's rights as well. Many of our current health interventions are less invasive and have significantly lower risk than prior, now outdated techniques. Yet there are some trade-offs. People now live longer than ever before. As we age, we become more frail and have greater number of chronic disease states, as well as require more medications to manage those illnesses. Overall, as we age, we have elevated health risks. Thank you for watching and sharing this information with others. I appreciate you clicking the subscribe button, and I'm thrilled with the growth of the channel. I've had several requests for videos, and I'm working on those. Several videos that have been posted are on information that was contributed by generous medical students and residents in the local area, and I'm grateful to each of you. If you made it through all of this, you deserve a treat. Consider a nap, as that is refreshing and low-cost reward, or go get a pedicure if you have the time and a few extra dollars to spend on yourself. Be kind to others that we share time with on our journey, Bye now.